Xi 2015 article on creating a chimera using gain-of-function type technology. While policy decisions should have been based on scientific data, some frankly were not. The burdensome 6-foot social distancing rule did not have sufficient scientific report. In your words, it just sort of appeared. Distancing made sense, but the 6 feet was arbitrary. Even Dr. Collins said he still hasn't seen any empirical evidence to support the 6-foot rule. A rule that shut down schools and businesses. A rule that will have negative ramifications for decades. As the pandemic wore on, more mandates also just sort of appeared. But the American public didn't get to see the scientific data to support these mandates. Americans were aggressively bullied, shamed, and silenced for merely questioning or debating issues such as social distancing, masks, vaccines, or the origins of COVID. Many Americans were willing to comply with the 15 days to slow the spread and understood the necessity of banning travel from certain countries in an attempt to slow down the virus. But many Americans became very frustrated when components of those 15 days stretched into years. And it should not have been the case that Americans were forced to comply with oppressive mandates when those who chose to illegally cross our southern border were not. Or when Governor Newsom or Governor Whitmer were throwing parties at nice restaurants. Not a good look. Americans do not hate science, but Americans know hypocrisy when they see it. Dr. Fauci, under your leadership, the United States health agencies adopted specific policy aims as a single dogmatic truth, without the benefit of debate, out of a desire for a single narrative. Dr. Fauci, you once said, if you disagree with me, you disagree with science. Science doesn't belong to any one person. I was never taught that science turns a blind eye to hypotheses. They serve to be proven or disproven, and done so with irrefutable facts, if able. It was interesting that you chose not to pursue an aggressive and transparent scientific investigation of both natural spillover and lab leak. We have been investigating both hypotheses. You testified before the Select Subcommittee in your transcribed interview that the lab leak theory was not a conspiracy theory. You embraced the proximal origin letter. It wasn't necessarily a full peer-reviewed research paper, but you embraced proximal origin letter and you shared it with the public from the White House lawn. You stated during your transcribed interview that you did not review published articles that considered a potential lab leak of COVID-19. This is especially concerning if the works in question were conducted at a more risky and less safe BSL-2 lab. Nevertheless, any dissent from your chosen scientific position was immediately labeled as anti-science. Anything less than complete submission to the mandates could cost you your livelihood, your ability to go into public, your child's ability to attend school. Families were thrown off planes and shamed when their 2-year-olds struggled to wear a mask. Children with disabilities lost access to therapy that they and their families depended on. Students were out of the classroom and told to attend school remotely, even when the science clearly demonstrated it was safe for them to go back in the classroom. This harmed low-income students the most. And how were single-parent households supposed to teach their own children and work at the same time? Dr. Fauci, you oversaw one of the most invasive regimes of domestic policy the U.S. has ever seen, including mask mandates, school closures, coerced vaccination, social distancing of 6 feet, and more. We've learned many lessons. Our early fear and confusion was understandable. COVID-19 was clearly a novel virus. Under your leadership, NIAID allowed disgraced characters like Dr. Peter Daszak to use millions in taxpayer dollars to conduct risky gain-of-function experiments in Wuhan, China. The actions of EcoHealth and Dr. Daszak call into question the integrity of NIAID's policies and procedures as a whole, as well as your role, Dr. Fauci, as NIAID's director. You did sign off on his research grant. We need to know why Dr. David Morans, your direct report for more than 2 decades, assisted Dr. Daszak in avoiding oversight and scrutiny and said that you were involved. Your senior advisor and seemingly your chief of staff repeatedly attempted to evade transparency laws to shield information from public scrutiny. We have senior officials from your office in their own writing discussing breaking federal law, deleting official records, and sharing private government information with grant recipients. The office you directed and those serving under your leadership chose to flout the law and bragged about it. Why did you allow your office to be unaccountable to the American people? You were the highest paid person in the government. This makes you more accountable to the people, not less. Dr. Fauci, whether intentional or not, you became so powerful that any disagreements the public had with you were forbidden and censored on social and most legacy media time and time again. This is why so many Americans became so angry, because this was fundamentally un-American. If I make a mistake, I answer to the people of Ohio who elected me and to my own conscience. When you and your agency made mistakes, Dr. Fauci, what happened? We all need to be held accountable. Sometimes it's as simple as saying, we were wrong. You took the position that you presented the science. Your words came across to so many people as final and as infallible